Good afternoon, and welcome to the Rockford Ready Workplace Safety Training on strategies to slow the spread of COVID-19. We are glad to have you with us today, or to those of you that might be reviewing this recording after the date. However, again, we're glad that you're tuning in, so thank you. You had some webinar housekeeping tips that were up that you could see. We're going to start. Our agenda today is just, I'm going to introduce myself, and then we're going to go over the relevance of COVID-19 risk prevention today. We know that there's a lot of COVID-19 fatigue out there. However, the role that HR professionals play in organizations in really kind of helping our organizations and employees to mitigate the impact of COVID-19 on businesses is still critically important. So we've got some really good content for you all today. So we're excited to have you. My name is Anquinette Parham. I am the Executive Director of Health and Human Services for the City of Rockford. And Rockford is a grantee of a health literacy grant from the U.S. Department of Health and Human Services Office of Minority Health. And so with those funds, we began an initiative known as Rockford Ready. So you can go ahead and go to the next slide and we'll share a little information about Rockford Ready. So Rockford Ready, like I mentioned, is our initiative to help improve the health of all Rockford residents, specifically by providing health education, connecting residents to health resources, helping to strengthen relationships between healthcare providers and residents. And one of the ways that we do this is through improving health literacy. So that's incredibly important. And along those aims, we also look not only to serve individuals, but also to serve entities, to serve healthcare organizations, and to serve business owners and other companies and groups that have HR departments to really help to increase knowledge and understanding about COVID-19 and how to mitigate its effects on the way that we carry out our daily lives. Next slide, please. So I'm going to share a little information about the relevance of COVID-19 risk prevention. So for us, Rockford is the county seat for Winnebago County, located in Northern Illinois. And so for us, our current community levels of COVID-19 is relatively low. If you look at this graphic here, you can see that our trends last year, to date, on October 19th of 2021, our daily average was 66 cases and 54 new cases. So when you look at us today, you see that we're kind of similar to that. Our daily average as of yesterday was 50 with 16 new cases. So we're lower than what we were last year to date. However, if you look at this graph, what you see last year was that we experienced a spike significantly going into the holidays and through the holiday season. So looking at that, if we look at last year as an indication, it's important because we may scale back up as we approach the holidays in terms of the impact of COVID-19 and the number of cases that we're seeing in our community. What we experienced last year as a community is that really COVID-19, those rates resulted in extreme health risks for a lot of people, high unemployment rates, business closings, and social divisiveness in the workplace. So again, it's really important that what we're talking about today is really kind of helping HR departments and HR professionals to help really position their organizations to mitigate some of these risks and help to provide information and have healthy dialogue and discussion about what they can do to make their workplaces more safe. You can go to the next slide. So again, here in Winnebago County, data shows that the percentage of residents in our county that are overall fully vaccinated is pretty good in terms of being over 60%. For senior citizens, those age 65 and over, that rate is at 88%, so that's even better than the rate for all residents. However, when you look at where we are currently on the percent of residents that have a booster, that number is significantly lower, being at only 33%. So that's less than half of all residents. Now, for those who are age 65 and older, it is still higher. That's over 70%. But again, not nearly as many folks boosted across the general population as we see that are fully vaccinated. So with that in mind, these numbers also include the children of residents and employees. So it is very important for businesses to do what they can, even still, in preparing for what may be another potential uptick and really helping to make their workplaces as safe as possible with regards to mitigating COVID-19. You can go to the next slide. So I think this quote is really important, and it just really shines a light again on why we're here today. The coronavirus pandemic not only expanded HR's corporate influence, but also led to a renewed focus on employees. And this is a quote from Tam Herbert from the SHRM HR magazine. And again, so important and really lending itself to why we're here today to talk about this. And not only did it expand HR's corporate influence, but it really kind of placed HR as a place for go-to information. Sometimes HR departments had to decipher and sift through what was coming in from mandates, depending on where you live. It could have been from your governor's office, from public health officials, and then also information that was coming out from our government. But depending on what industry you worked in, sometimes there were additional regulations or requirements across certain industries and from certain funders and regulators. So HR really was a leader in terms of where information was coming from and what information was applicable to certain employees, certain industries, et cetera. So this conversation about the role of HR in terms of COVID mitigation is critically important. And so with that, we're very excited today to have Naomi with us. And Naomi is an expert in her field. I'm going to have her join us. She can come on screen and introduce herself to our guest today to share what you have about this topic with us. Welcome, Naomi.
Thanks so much, Anquanette. It's a pleasure to be here, and thanks for taking action to keep your community at Rockford safe and really focusing on equity and communicating about health literacy. That is so important. Thanks to all the participants joining us today. And for those of you who are watching this on video, I'm Naomi Light-Givon. I'm Senior Program Manager for an initiative called the Health Action Alliance. The Health Action Alliance now includes more than 4,000 employers across the United States who could collectively reach and employ more than 17 million workers. And what we do is offer free tools, training, events, webinars like this one to help employers in our network navigate evolving health challenges, improve the health and well-being of their workers, engage with public health partners to build stronger, more equitable, and healthier communities. You can move to the next slide, please. And the next one as well. The Health Action Alliance is a joint initiative of the Ad Council, the CDC Foundation, the De Beaumont Foundation, the National Safety Council, and the Robert Wood Johnson Foundation, together with our social impact firm at Mediarite. And we're informed by these top experts in public health communications and business management. And so you can move to the next slide. So, and just you can appear the whole agenda. Perfect, thank you. So before I dive in, I would just wanted to give you a quick overview of what we're going to go over today. And please feel welcome to pop any questions into the chat or use the Q&A function if you'd like me to talk more about each of these things while I'm going over them. So we'll start today with a discussion of why employers and HR leaders and managers and professionals are so important in slowing the spread of COVID-19 in the workplace and in your community. Then we'll move on to how you can get started in doing that if you haven't done so already. We'll talk a little bit about how HR departments and businesses can take action to support working parents to get their children vaccinated against COVID-19. We'll walk you through this decision tool that we've created so that you can make informed policies for your workplace. Then we'll also go over, as you saw Anquanette share earlier, boosters are not widespread right now across the country and what you need to know as an employer, as an HR leader. And then lastly, we'll talk a little bit about how you can prepare for the future and any potential COVID-19 surges in your community or pandemics and health crises well into the future. So with that, we'll get started on our first agenda item, which is that, as you may know, COVID-19 has exposed the link between business and public health. Businesses, as I'm sure you've all experienced, are facing hiring shortages, employees being routinely absent due to COVID-19 exposure, illness, or illness in a family member, and it's made it a very challenging time, coupled with inflation and a potential recession. Anxieties are high, and businesses can do a lot to support their employees and maintain resilience during this ongoing pandemic. Next slide, please. So why can business do all of these things? Why is business so important? It is because 74% of Americans trust their employer more than any other institution. That's a huge deal. It's not just any employer, it's my employer. So as an employer, you have so much power to help support, influence your employees and their own personal health decisions. Next slide. And on top of that, a report demonstrated that 73% of Americans want to work for a company that actually protects its employees during a pandemic. So you have this opportunity not just to be a trusted messenger for your employees, but also to fulfill something that your employees want you to do, which is protect them during an ongoing public health crisis or pandemic. Next slide. And employer action really matters. Studies from the Kaiser Family Foundation have shown that 73% of workers whose employers encourage employees to get a COVID-19 vaccine receive at least one shot. And 41% of workers, if you just hit the space bar, 41% of workers whose employers did not encourage vaccination got at least one shot. So you can see there's a huge difference in between employers that talk about the COVID-19 vaccines and employers that don't. Next slide, please. So 2 years later, we know what works, and you as employers probably do too. So encouraging mask use during a surge of COVID-19, high quality masks reduce transmission by 83% of the virus. Ventilation systems, so improved ventilation systems, HVAC filters, air sanitizers and cleaners, airflow reduces transmission up to 50% in the workplace. Social distancing also works. And using reliable COVID-19 tracking tools to adapt your workplace and be flexible when the pandemic changes around you. Next slide, please. Most of all, what we know is that a fully vaccinated workforce creates the safest possible workplace environment for employees and customers. And now that includes the booster shots that are readily available for anybody in the United States across the country, ages 5 and up. Next slide. So before we continue to dive into how you can get started and creating your policies and making decisions for your workforce, I just wanted to share a couple of key things that you can do right now to protect your workforce. Right now, as we heard from Anquanette, the levels of COVID-19 transmission and spread in your community are currently low. It's a great time to prepare for a potential surge as the weather continues to get colder, as people begin to gather in close quarters for holidays coming up. It's really important to take action now. So one, the first thing you can do is make it really easy for employees to get vaccinated and boosted. You can also consider weekly testing, rapid antigen testing for all of your employees. You can also help your workers navigate reimbursable home tests. Their insurance companies must provide them with reimbursements for purchased COVID-19 tests. But you as the HR and benefits leader in your workplace can actually help navigate that system because not all employees will know how. And then also, of course, continue to support employees' abilities to isolate if they're sick with any virus or if they test positive for COVID-19. Next slide. You can also continue to communicate your COVID-19 policies and procedures. If you haven't been doing so already, You can get started right now. Now is better than never. Please record and report your COVID-19 infections and deaths to your local public health departments so that they know what's going on in your workplace and can support you if there is an exposure or an outbreak. Implement protections from retaliation for workers who might be concerned about COVID-19 related work hazards. So make sure your employees feel safe and comfortable to talk to you, their HR professionals, on challenges they might be seeing in a workplace. Make sure you perform routine cleaning and disinfection and maintain and improve your ventilation systems. Next slide. So how do you get started? Well, at Health Action Alliance, as I promised, we try to make it really easy for businesses large and small to get started in taking action on COVID-19 and other workplace health and safety measures. So you can move to the next slide. Back in March 2021, we launched the Health Action Alliance with a quick start guide on how to prepare employers and customers for COVID-19 vaccines. This is when vaccines were just becoming available to residents of the United States across the country. And so this guide is really comprehensive. And on our website, it can walk you through each step in the process. 1, tips for how to make it easier for your employees to get vaccinated. 2, tips on how to educate and encourage your employees to get vaccinated. 3, tips for engaging disproportionately impacted workforce populations. Those are your immunocompromised populations. Those are your populations that are older. Those are your populations that might be more hesitant to approach healthcare providers or live in a community in which the healthcare system and the environmental health is not as safe, or frontline workers. Of course, they are more likely to be exposed to COVID-19. And then finally, how to support some community strategies to support your community, not just your workforce. And so I will actually drop a link to that guide in the chat for you to take a look at. But in the meantime, we can go to the next slide and I'll walk you through the first thing you can start doing to take action. So I'm just going to drop that in this chat so that you'll be able to see it and go to our website whenever you'd like. That's our quick start guide. So first, great, thank you. Remove barriers to vaccination. Relieve any concerns about costs for vaccines with your employees. Vaccines are free. Offer paid time off for employees to get themselves and their eligible family members vaccinated. And we'll talk a little bit more about that a little later on. Offer paid time off for recovery from potential side effects. Many people experience mild side effects, but they can sometimes have a fever and they need time off to recover from that. Cover out-of-pocket expenses associated with that vaccination. So potential transportation challenges, childcare, meal vouchers, etc. Offer internet access or language support to help schedule appointments. And you can always, in partnership with your local public health department or your local public health providers or pharmacies, host an on-site vaccination clinic for your employees and their families. Next, you can educate your workers about vaccine safety and efficacy. So there's lots of ways you can do that. Emails, home mailers, vaccine education with trusted messengers. So as an employer, you are a very trusted messenger, but you could bring in a community leader that's really trusted with your workforce population, whether that is a faith leader, community-based organization. Bring in people who are trusted by your workers. You can hold staff meetings and employee town halls, whether in person or virtually, to talk about COVID-19, allow employees to address their concerns. You can send out employee newsletters with information, have other employees talk to the employees that have yet to be vaccinated or boosted about their experience. You can place posters up in your workplace. You can use PSAs, public service announcements that have been created by our partners at the Ad Council to talk about vaccines. You can have over the speaker or in-store radio announcements, and make sure you provide information in language that's accessible to all of your employees. So having information in multiple languages is really helpful. Next, you can also make sure to engage and support disproportionately impacted populations. Acknowledge the role systemic racism has played in healthcare and disparity in health outcomes. Understand the unique challenges and concerns of specific workforce populations in your company. And as HR leaders, you should know about the makeup of your company and your employees. Ensure vaccine education is culturally and linguistically relevant. So again, working with community-based partners to make sure that is the case. Create a safe and supportive workplace culture for all of your employees. Make sure everyone feels that they belong. And again, engage with community-based organizations to educate and engage diverse communities. Next slide, please. And you might be thinking, okay, we've done a lot of this, but we still have employees who are hesitant or cautious about the vaccines. They've heard a lot of misinformation. What can we still do? Well, employers can still help motivate these cautious employees through convenience and modest incentives. Research has shown that 37% of employees who are still undecided about vaccines say they'd be more likely to get one if their employer arranged for on-site vaccination. 30% would do it if the employer offered a $50 incentive, and 28% would do it if they offered paid time off to get vaccinated and recover from side effects. So you still have tools at your disposal to help motivate uncertain workers. Next slide, please. Thank you. So we talked a little bit about community support. Well, the most immediate community around your workers is their immediate family and household members. And now, with vaccines being eligible for children ages 6 months and older since June, it's more important than ever that workplaces encourage working parents to get their children vaccinated. When working parents vaccinate their children, they might need paid time off or flexible scheduling or other support to do so. Most children under the age of 3 cannot get vaccinated at a local pharmacy. So they have to see their pediatrician or go to a healthcare clinic that is authorized to vaccinate children ages 6 months and up. It is not as easy for a young child to get vaccinated as it is for an adult to just walk into any clinic. So that's really important. You can also offer transportation, language support, or internet access to making those appointments. Provide financial support for childcare for other children. If a worker has to take their children to the pediatrician, it might be difficult if they have more than one child. So providing some of those incentives might be very helpful. Again, offering a modest monetary incentive. Share trustworthy information. Maybe bring in a local community pediatrician to talk to your parent workers about vaccines for children, their safety, and their efficacy. And you can also host a vaccine clinic where families of your workers and even community members are able to come and get vaccinated. And we'll talk a little bit more now in the next slide about why COVID-19 vaccines for children are so important. So you may have heard that COVID-19 is mild in children. And generally speaking, it is milder in children than it is in most adults. However, 6 kids in the US are 6 times more likely to die from COVID-19 in 1 year than they will from the flu. That means COVID-19 is 6 times more, if not more, severe than the flu for children. And the best protection for all of these eligible children against severe reactions to COVID-19 are vaccinations, and now even boosters. You'll see that 29.9 million US children have received their primary COVID-19 vaccine series. But 41.8 million children under the age of 17 have yet to receive their first COVID-19 vaccine dose. That is a huge number of kids who are not protected against COVID-19. With the coming winter season, now is the time to take action. Next slide, please. You can see these numbers a little differently. 58% of US children ages 12 to 17 have completed their primary series. 31% of US children ages 5 to 11 have completed their primary series. So it's 58% of middle schoolers and high schoolers. 31% of elementary schoolers, but only 9% of children not yet in school have completed only 9% have completed at least one dose of their primary series. So there's a huge opportunity to act when there are 22 million children under the age of that are age 4 and under that still need to really get their COVID-19 vaccines. And now children ages 5 and up are eligible for their boosters, which, as you saw earlier from the numbers, many are not boosted. And now they're also eligible for the bivalent, the new Omicron booster. So we'll talk a little bit more in the next slide about why, as workplaces, you should be really concerned about this. Well, working parents are especially vulnerable to absenteeism and the inability to return to the workplace due to COVID-19 challenges because of children who are sick, who are exposed, and who are out of school. 4 in 10 parents say that they or another adult in their household left a job or changed work schedules to care for their children in the past year. We've seen this now over the past 2 years because of the pandemic. Next slide, please. This is even more challenging for women, communities of color, and lower income families. 53% of Black parents say that they or another adult in the family has left a job or changed schedules in order to care for children. 51% of parents with lower household incomes say the same thing. And 1 out of 5 parents say the person in their household who left a job or changed their work schedule is still not working or continues to work reduced hours, rising to 1/3 of Black parents and nearly 4 in 10 lower income parents. So vaccines for children are not just a worker issue, it's a health equity issue. It's really important that parents from communities of color and lower income families have easy access to COVID-19 vaccines for their kids. Next slide, please. And another source shared with us that 1/4 of working parents of unvaccinated children ages 12 to 17 years old say they would be more likely to get their children vaccinated if their employer offered paid time off to do so. So if an employer actually offers that paid time off for parents to take their children to get vaccinated, 25% more children might actually be vaccinated in your company's community circles. So at Health Action Alliance, we try to make it really easy for you to be able to take action on these issues. And so you can download all of our resources on COVID-19 vaccines for children for free at healthaction.org/COVID-19. And I will drop actually 2 links into the chat now for you to take a look at that will help you understand why this is a health equity issue, as well as a sample CEO letter that you can use to talk about your policy and to have your company provide benefits to parents, working parents. So now the next slide, please. We're going to talk about how you can determine what's right for your company and your employees. Every company is different. We know that. But if you go to the next slide and then the following slide, we have created an interactive decision tool for employers. And so this decision tool we created when companies were trying to determine if they would be able to actually require COVID-19 vaccines for their workplaces, for their workers. And so this decision tool actually helps your workplace determine whether or not you should require vaccines for your workplace. The first thing I want to share with you is that you as an employer are allowed to require a fully vaccinated workforce with, of course, religious and medical exemptions. And so you then now want to kind of figure out how to determine what you should be doing in your workplace based on all of your workforce makeup, the community in which you live, your population, what type of work your workers actually are doing. Are they at higher risk for COVID-19 the infection and disease and death. So these are some of the questions that you should be asking yourself when you're trying to understand whether or not you should put different requirements in place. So this decision tool for employers allows you to walk through the health, legal, and other considerations that you need to take into account when making these decisions in your workplace. It will help you answer questions such as, should I require employees to wear masks? Should I require COVID-19 testing for my employees? Should I track or restrict employee travel? How do I manage a partially vaccinated workforce? And can I ask customers for proof of vaccination or deny service to customers who aren't vaccinated? These are just some of the questions you might want to ask. And actually, in the next slide, I have listed out all of the different questions that you can walk through in our decision tool, which I did drop a link in the chat so you can actually do it. Once this webinar is over, you can walk through it and figure out what questions you need to answer. So as I said, should I require COVID-19 vaccines for my employees? How should I handle vaccine exemption requests? What are my options for confirming vaccination status? Should I offer workers paid time off for vaccinations and recovery? If I don't require vaccines, how do I manage a partially vaccinated workforce? Should I require COVID-19 testing for employees? Should I require my employees to wear masks? Should I track or restrict employee travel? Can I ask customers for proof of vaccination or deny service to customers who aren't vaccinated? And what other public health and safety issues do I need to consider? So this tool will help you answer all of those questions. And again, it's just in the link in our chat, or you can go to healthaction.org/COVID-19 and you'll see the decision tool right on that webpage. If you go to the next slide, the next two slides, actually, we went through this slide already. So the next slide. This just kind of shows you a screenshot of the website as to what you would be able to see. So should I require COVID-19 vaccination for my employees? Health considerations. Well, existing vaccines have been proven safe and effective at preventing the spread of COVID-19 and preventing severe illness and death. Vaccines and boosters are shown to be effective at preventing serious illness. And the CDC recommends people get vaccinated and boosted even if they have already had COVID-19. Evidence is emerging that people get better protection by keeping their vaccinations up to date compared to with having had COVID-19. You can also see what those legal considerations for vaccine requirements are and any other considerations you might need to take into account. And once you are able to go through each question, you then see if you want to select yes or no on the right-hand side of the screen. And once you're ready, you mark your decision, and then you can continue to move on to the next question. So I hope you'll find this tool useful. If you don't currently have COVID-19 vaccines or masking policies in place, please make sure to use this tool, walk yourselves and maybe your environmental health and safety department through it so that you can make that decision for your workplace. Next slide. So what is next after we make these decisions, after we put in policies in place? I want to talk a little bit about where we are in the pandemic and what you need to know now. So next slide, please. Booster shots are what you need to know about now. In a recent survey by the Kaiser Family Foundation that came out at the very end of September, nearly half of the public has heard little to nothing about the new COVID-19 booster shots. So you, as a trusted employer, as an HR leader, have the opportunity to tell them that booster shots are here. They're safe and effective. Anyone ages 5 and up are eligible for the new booster shot that is more tailored to fighting the Omicron variant of the coronavirus, which is more transmissible. So it's really important that you, as that trusted messenger, can share that information. And then, of course, do all the things we previously talked about in helping your employees get that booster. This report also shared that 40% of fully vaccinated adults say, that means they've completed their primary series of at least 2 shots, say that they're not even sure if CDC has recommended that people like them get the bivalent booster. So even people that have received their primary series of the COVID-19 vaccine aren't certain that they should be getting this new booster shot. So again, you as a trusted messenger can share this information really easily with your employees. Next slide, please. So what do employers really need to know? These updated COVID-19 booster shots are available for everyone ages 5 and up. They have been specifically designed to strengthen immunity against the original coronavirus strain and the newer Omicron subvariants of BA.4 and BA.5, which are still the dominant strains throughout the US. These highly contagious strains have been infecting and reinfecting people with COVID-19. So if you've had COVID-19 before, you can still get it again. The updated booster improves your body's ability to prevent infection and especially to prevent serious illness. Next slide. So at Health Action Alliance, again, we want to make it easy for you to take action. And so we've created a booster checklist for employers. There are 5 simple things that you can do. 1, share facts about the safety and efficacy of the COVID-19 boosters. You can use our key messages that you'll find at healthaction.org/COVID-19 to craft your employee communications. Provide paid time off for employees and their children, eligible family members, to get their boosters and recover from possible side effects. 3, encourage employees to use vaccines.gov to find where they can get their booster shot. In major retail pharmacy chains, including CVS and Walgreens, are also offering online appointments for scheduling. And many states have websites to help you find clinics with the new boosters in stock. Engage your employee resource groups to make sure that your employees have the latest information about boosters. Make sure they are seeing other employees getting their shots and answering questions they might have. Make sure to address any unique access challenges for your workforce. Remember, it is so important to make it easy as possible for your workers to get their questions answered and access to these boosters. And of course, reach out to your local public health department to learn more about hosting a booster clinic at your work site or co-hosting one with a local pharmacy. This makes it the easiest for your employees and their families to access these new boosters. Next slide, please. So where do we go next? And you can click the screen as well. Thank you. As you know, COVID-19 won't be the last major health threat we encounter, even though people are feeling that the pandemic is over. So we're really encouraging employers to be asking a different question. What are we doing now to prepare for what's next? So next slide, please. Preparing for the next pandemic or whatever comes next starts now. In a recent survey, 30% of executives say that they expect another pandemic before 2025. That is not very far away. We're almost in 2023. And this pandemic is not over. We are still in a COVID-19 pandemic. So you can continue to prepare for the future now and for the next surge now. Executives have also said they expect 50% of them expect another pandemic in the next 10 years. And so really it's time to learn from what we experienced during the last 2 years of the COVID-19 pandemic and start taking action now to prepare for more resilient businesses in the next one. And so what we did at Health Action Alliance, you can go to the next slide as I drop some links in the chat, is create a pandemic preparedness playbook for business. And so you can actually see this plan at our website at healthaction.org/community, or you can go to the link that I'm dropping in the chat now. I've dropped in a blog post on the booster shots so that you have that for reference. And I've also dropped a link to our pandemic preparedness plan in the chat. And so what HR leaders and emergency health, environmental health and safety professionals can take a look at, as well as your communication leaders, your risk mitigation leaders, your CEO, can do is take a look at our pandemic preparedness plan for business. This plan helps you understand the business case for investing in community health, provides learnings from companies who responded successfully to the COVID-19 pandemic, and an action plan to guide you to partner with public health departments and engage in community health for business resilience. And so we hope you'll take a look at that and find it really helpful in preparing for whatever comes next. You can again go to healthaction.org/community to take a look and learn more. And finally, if you need extra support on pandemic preparedness, on taking action on COVID-19, or in workplace mental health challenges you might be facing due to the COVID-19 pandemic or the forthcoming recession, you can email me at hello@healthaction.org, and we are here to help you. We offer some free coaching and training to help employers develop or evaluate their pandemic preparedness plans, as well as taking action on COVID-19 challenges you're facing right now and on workplace mental health. So I hope that we can continue to be of help to your community in Rockford. Next slide, please. I wanted to invite you also to participate in our next 2 upcoming events. We are hosting a National Business Summit on mental health equity at work in partnership with the American Psychological Association, One Mind at Work, the Ad Council, and Mental Health Action Day. So I hope you'll be able to join us, and you can see all of our events at healthaction.org/events. And finally, we are also hosting a national employer briefing in about a month from now on managing recession anxieties, strategies for employers. We have been hearing from businesses over and over that they're worried about the financial health of their workers. They're worried about the anxiety that's happening in the workplace around this topic. And so we're hosting a briefing on that as well. And so we hope to see you there. So with that, I think, Antoinette, you're going to rejoin me to help navigate any questions you all might have from this session. I know this was a lot of information, but I really appreciate the opportunity to be here today and to talk to you. So thank you so much. You can also go to the next slide with my email address on the screen. And so you can always reach out to me, Naomi. I'm here to help, and thank you for your time.
Thank you so much, Naomi, for all of that great and really critical information. If any of our participants have questions, please feel free. You can utilize the Q&A feature within the webinar, or you can post your question in the chat. If you would like to raise your hand in order to be unmuted, you have that option as well. So any way that you'd like to engage with us, we're open to that. So please, if you have questions, go ahead and place them in any one of those methods right now, and we will get your question addressed. Let's see, I don't see any others there, but I will say, I do want to note that in case anyone was wondering, the information that was shared here, these tools that are being provided by the city of Rockford, there is not currently a mandate on utilization of these tools, but we are providing them as a resource to our community as a whole, knowing how important COVID-19 mitigation is. So while they're not required, these are definitely high quality resources that are being provided to us by national experts in this area. And so we want to make them readily available to HR professionals and business owners in our community as a resource. So on behalf of Rockford Ready, we welcome you all to please use these tools that have been shared with us today by the Health Action Alliance. And please save your chat, get all of that information, but it is there. Additionally, in case anyone was wondering, today's webinar is being recorded. It will be available on the Rockford Ready YouTube page. We'll also share some information on our Facebook page about it as well. So the information will be available going forward. Let's see, how can individuals provide feedback about these tools? Naomi?
Yeah, absolutely. You can just email us anytime. Go to our website, send me an email. You can reach out at hello@healthaction.org. All of our tools are based on the most up-to-date CDC guidelines, as well as going a little bit above and beyond those guidelines to help give you a sense of what is possible for your business. So reach out to me at hello@healthaction.org. You can browse our entire website. If you need help navigating, just shoot me a note. We're here to help. Our mandate is to offer these tools for businesses across the country to take action. So we are here to support you.
Great. Let's see, I have another question. COVID-19 is too divisive. How can we talk to staff without them feeling like we're talking at them?
That is such a great question. So first, don't talk at your staff. Listen to your staff, right? Ask them, how are you feeling? What's going on in your life? Are you worried about COVID-19? And really truly listen before talking at them. Then when you're communicating with workers, most workers are in this kind of still, I'm just going to wait and see category. But they're actually more likely to get vaccinated if they actually hear that COVID-19 vaccines and boosters are 100% effective at preventing hospitalization and death, right? It's like, this is not about trying to tell you what to do with your body. This is about providing a safe space for every person who is in our environment, and and having them be able to ask their questions and get answers that are fact-based and non-judgmental. Rely on straightforward messages. So don't make it complicated. Say you want to create a really healthy environment for all of your workers, and tell employees what you're doing. Did you upgrade your HVAC filters? Let them know. Are you monitoring with a CO2 monitor the carbon dioxide emissions in your workplace so that you can make sure there's good airflow? Let them know. Tell them you're monitoring with the local public health department the rise in cases, so that if you see that there's a spike that's starting to happen, that we see those trends, say, we want to make sure you're safe, you're able to work, you're able to provide for your family, that our customers are safe. Just let them know what you're doing to do that. And you can just say, we're not requiring you to be vaccinated, but being vaccinated keeps you and all of your colleagues and your families the most safe you can be. And when we see a surge, we're going to require masks, and we'll provide those high quality N95 masks to you in order to make sure that you are safe. And we're going to implement new distancing measures to make sure that that we are not causing a spreading event in our building, right? So just talk to them about what you're doing. Be very factual. Be very simple. This is about protecting everyone's health and safety.
Great, thank you for that.
Of course.
Let's
Any other messages that I can share? There's one more. So here are a couple of things that if you're trying to figure out how to talk to your employees about these vaccine messages, there are a couple of things to avoid. So for example, don't say things like getting vaccinated is the right thing to do. Don't say that. Instead, share your story about why you decided to get vaccinated. Don't talk about moments missed or getting back to normal. Everyone already has pandemic fatigue. So just rely on facts and share trusted information about safety and efficacy. And don't try to convince or explain to your workers why they should be getting vaccinated. Make sure to encourage them to talk to their doctor if they still have questions about the vaccine.
And that kind of actually relates to this one last question, which you touched on a bit, but it asks that how do we deal with the fact that a lot of people feel like the pandemic is behind us, and how can we make the topic and the protocols feel relevant to our staff? Now, you did share already that, employers are still seeing regular absences as it relates to COVID. We've looked at what the vaccination rates are for children, how that impacts employees' ability to be at work and be productive. Anything else you want to add about how we can still keep this topic and these protocols as something that's relevant to our staff?
So I think using the language of preparing for the holiday season and making sure workers are able to be with their families and take the time off and have safe holidays is a really great way to talk about why the COVID-19 boosters and vaccines and safety measures are relevant right now, because we want you to be able to spend the time that you're not at work with your families, right? And we want you to be able to be safe at work. And we don't want you to have any unnecessary missed work days or missed school days. And so I think that is still going to be right now, because of the holiday season that we're approaching, going to be some really messaging that resonates with everyone, that being able to spend time with your families, not having, sometimes if you use up all of your paid time off, because you've got, because you got sick from COVID, we don't want you to have to also miss that time with your family because you don't have any more time off. So think about ways that are relevant to your workforce now, and just continue to tell people that the boosters are safe and effective and they help to prevent severe illness and death and keep everyone safe. I hope that is helpful. I know
Yes.
everyone is done hearing it. And that's also why we're encouraging rapid testing. If people don't want to wear masks or people don't want to get boosted, and you have an environment in which you can't do any more upgrades to your ventilation, or you've done all the upgrades, or you have to keep it closed because of temperature challenges in your building, use rapid tests. Those are a great measure to know if someone is contagious. So if you want to have an all staff meeting in one closed conference room, right? If you decide that that's something you need to do for your business, have everyone take a rapid test that morning when they get to the office. Provide that to them. Someone's traveled and coming back from a flight, have them take a rapid test. And so it's a really good way to catch the virus and make sure that everyone is safe. So if you have the ability to do that, that'll really help your workforce stay safe. Encourage employees to take rapid tests before meeting their families as well. So I think that's the best we can do, and we have these great tools to do it. So stay safe out there, everyone.
Thank you. Those are great tools and tips, and that's excellent messaging for all of us to keep in mind as we really strive to keep our workplaces as safe as possible. So thank you. Thank you for all of that. And I just want to remind everyone and encourage you all to take advantage of the resources, the links that have been shared throughout the presentation and here in the chat. Again, those resources are readily available to all of you. Reach out to Naomi, as her organization is willing to do consults and offer help to organizations. That's what they're here for. So please don't be shy. Take advantage of all the resources that we've offered today to really help us to move forward and to continue to keep our employees and their families safe. We appreciate your participation. Please sign up for our newsletter at rockfordready.org. Stay connected with us on Facebook. You can also text the word READY to 815-491-1317 to receive text updates about what Rockford Ready is doing in our community. Standard messaging rates will apply to that. But again, we want to thank you all for joining us today, and I hope you have a great rest of your week and a great holiday season. Please stay safe, stay healthy, and help encourage your employees and their families to do so as well. Thank you so much for joining us today.